Ladies and gentlemen, for joining us today on this Zoom information session on safe and successful operation of school buses during COVID-19. My name is Drew Ferguson. I'm the Public Media Relations Coordinator for the Grey Bruce Health Unit, and I'll be the moderator for this session. Joining us from Public Health are the Medical Officer of Health, Dr. Ian Era, and the Manager of the School Health Program, Sarah Ellis. Also with us, Gary O'Donnell, Director of Bruce Grey, Catholic District School Board, and I think Steve Lustig is online too, Manager of Transportation. And I have to throw a thanks out to Steve for coordinating today's event and getting everybody together on this. People are online with video and online with phones. So following my introduction, the format of the meeting will be to open remarks by Dr. Era, who will provide some additional content, and then we'll address the audience questions. We've received a number of questions, so we've compiled them into some basic themes, and following Dr. Era's initial remarks, I'll go through the questions and put them to Dr. Era. If you're on a computer viewing, you can put additional questions in the chat box, and we'll see if we can get through them in time. If you don't have a computer or you don't get the two specific questions, you can always call your questions in on our helpline, 1-800-263-3456, extension 3000. Or you can forward them to Public Health through our Contact Us webpage, and we'll respond to all inquiries. That mail is publichealth@publichealthgraybruce.on.ca. The Health Unit, both boards of education and the province have extensive resources available on their website, so I urge you to consult those consult those resources for most up-to-date information. This session is being recorded and will be available on the Grey Bruce Health Unit YouTube channel. A link will be provided as soon as it's made available. And to get underway, it's my pleasure to introduce Dr. Ian Era, Medical Officer of Health.
Thank you, Drew. Good afternoon, all. Thank you for your attendance and concern. And most importantly, thank you for the great work all around to commit to the education of our kids and ensure that the school system is running. The work that you do is very valuable. Much attention was given to first responders, to the healthcare providers, and rightly so. The work that you do is as important and as essential during the pandemic and during other times as well. And during the pandemic, it has the added layer of potential increased risk, and that's where our team, working with yourself, working with the school officials, with your companies, to ensure that risk is mitigated and minimized to the best of our ability. In terms of a situational assessment of the outbreak in Grey Bruce, I am pleased to share with you that we continue to have optimal control over the outbreak. As the Medical Officer of Health, I am concerned, and I will continue to be concerned until we put the last nail in the coffin of this pandemic, hopefully through the vaccine that's safe and effective. And some of you might have heard the news yesterday about a candidate vaccine reaching the finish line of safety and efficacy over 90%, which is great news. It was expected with the efforts put into that investment, into that intervention. And we have talked about it before in different settings by myself and my team that by the end of this year, we're cautiously optimistic we will have the vaccine approved, and within 3 to 6 months, it will be distributed to the mass public. So I'm starting by probably the end of this. I can see the light at the end of this tunnel. Until then, we really need to continue to do what we're doing. The measures that are in place to ensure the safety of everybody in the community, the most vulnerable, and in specific in the school sector, the safety of the students and the staff, including yourself. We have been working with school officials since midsummer, and our team has actually been planning a bit earlier than that. The reopening stages started in May. The team here was working on potential opening stages to probably prepare, to prepare the businesses to and the organizations in Grey Bruce for safe reopening and to hit the ground running as soon as we get the green light from the ministry. And to my delight, the plans that we put in place projecting what the ministry's plan are were almost identical. We use the same method and the same scientific data. So since April, we started working on reopening, including reopening in schools, not specifically and vigorously at that time, just because we need to go through the stages and these plans change. However, midsummer, we connected with the school officials and we met on a regular basis to ensure we have robust communication, robust measures in place to prevent and to respond if there are cases. So these measures, as you probably practice them on daily basis, whether it's screening of kids and staff before going to school, this is a very effective measure. And I can go in more details. I believe we have enough time during the questions to address some of these if the question is there, and if not, I'll go back to it specifically. Screening before kids come to school, that really nips in the bud many potential transmission, except for asymptomatic. Asymptomatic, again, I'll address it as we go. The disinfection in schools, the cleaning, signage, cohorting, all these things would be added layers. Using masks, encouraging using masks for students, and using PPEs in different settings. Again, another layer of intervention. Reminders of the 2 meters whenever possible, and it's not binary, you know, the 2 meters or 1 meter. The distance is the main factor there. The number of people in a specific setting, all these things have been calculated for different settings and communicated and refined. I realize some people might think, you know, if all these measures are not in place at the same time, we're in trouble. And the simple fact, it's not. These are added layers. If we're talking about a setting that's high risk, like a hospital where cases actually end up in the hospital, or like a dental clinic where there's interaction between the patient and the dentist, touching face for an hour, those scenarios require having all the measures in place at all times. Having the measures in a school or in the bus itself, having as many of them as possible is good. One of them could be sufficient. Regardless, if we put all these interventions on the side and we tackle the issue or look at it from a different point of view, we have right now the luxury of looking back at weeks and weeks of operating of schools, and there has not been a transmission. There has been zero transmission that's reported in schools in Grey Bruce. And we have 2 examples where there were cases in schools, and in one of them there were cases on a bus, and there was zero transmission. To that end, I am concerned, and I will continue to be concerned, and this concern is essential in ensuring we're not lowering our guard. However, the interventions that we have in place are sufficient to ensure safety and ultimately to ensure the educational environment for our kids. If I may add one point there, Drew, before we go to the question, is related to the response from public health and school staff when the cases were identified. That was the first time we deployed these measures, these protocols in the 2 situations in 2 schools. And I can report to you firsthand, these protocols have been deployed in an optimal way. The communication with the school officials was robust, was quick, was complete. The evaluation of the risk of different settings, including buses, communication with whomever needs to be communicated, was done within the 24-hour period. And now we have the luxury of time looking back and seeing there was no transmission. So that's reassuring that going forward, we have the tools and the communication level in place to ensure safety of yourself, of the students, and ultimately safety of everybody in the community to the best of our ability. And whenever I use the word we, I'm using the collective we, all of us. It's not, Ian, it's not the Grey Bruce Health Units team. It is the collective of us working together to ensure the relatively positive results that we have in Grey Bruce. So I'll stop there, Drew, and turn it back to you.
Thank you, Dr. Eric. I'll move right into the questions. Number one, you kind of alluded to it, but I'll get to it again. Given that positive cases of COVID-19 are almost as contagious for 2 days or more before they start showing symptoms, and that people without symptoms are also discouraged from getting testing, so how does self-assessment by both drivers and students prevent the spread?
Good question. So when people are identified as cases, usually we go for 2 days before to find who they interacted with, to potentially see if there are secondary close contacts, potential secondary cases. The science behind it goes to, there is a period of shedding. It's usually hours before the symptoms. It's not 2 days, maximum for around 24 hours. And to be on the conservative side, we go 48 hours before. So again, everything we do is conservative, overkill, because we don't risk safety. Odds are we have been able to identify these individuals quite quickly because that's already in place ahead of time. The cohorts are clear. So that process would proceed very quickly. If there is transmission, we would ensure it is not, if there was transmission in the past between these individuals, all these individuals will be in isolation going forward. So if they convert into cases, there will not be a secondary transmission. Again, is the screening a silver bullet? No, but it's not the only thing in place. It really nips in the bud the majority of potential transmission to start with. Then we will add the physical distancing, cleaning, hand washing, and that usually reduces the risk for the rest of people as well. And again, let's forget about the theory behind it and look at the stats. There were 2 cases in schools, or 2 situations with 4 out of 0 transmission. And we continue to have that success in different settings. But some of them are higher risk than a school, whether it's long-term care or others. So I hope I answered that question about the 48 hours. It's a conservative estimate. It's overkill, and it's supported with other measures.
I believe that's my question, and I would like a little bit more clarification, if you don't mind.
Go ahead, Stuart.
So, from everything I've read, most contagious days before they start showing symptoms, and in my case, I drive a school bus, as we all do. I have no social distancing on that school bus because there's no space for that. I have the mixture of dozens of family cohorts which attend 14 different classes distributed over 5 different schools. Now, my understanding is that Ontario is way behind and lacks the capacity to do contact tracing. So I don't have very much confidence in your assertion, Dr. Arar, that this is being followed up in a timely manner and that it could not spread far and wide before anyone is even aware of it.
Sorry, I missed the first part by answering your last part. Then I'll go back to ask you kindly if you can repeat the first one. Contact tracing has been challenged in the province, but not in Grey Bruce. We have upped our capacity and we have been proactive about it. We continue to keep the track record of response within 24 hours to 100% within 24 hours to 100%. So I can reassure have been on top of. I wonder if somebody can.
I wonder, Stuart, if you could unmute, please.
Okay.
Okay, you're there now.
Yeah. So does that mean I have the floor? Okay. 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 So the back to that a bit again. Potentially, the number of cohorts on a bus, on my bus, for example, are in the hundreds that are going to be impacted because of the intermingling of all these different cohorts in different schools and different classrooms, etc. And so that, I mean, that's a lot of contact tracing. If you're able to do all that in a timely manner, that's good. It seems to me that we rely entirely almost on the masking, since social distancing is not a possibility. And since, especially with winter coming up, we're going to be in an enclosed space for a prolonged period of time. So that airborne transmission, which I understand is the primary mode of transmission, will be a risk. And what was the third C? I've forgotten, but I'll go with that for now.
So I think Dr. Era dropped off. Is that correct, Drew? I think he was having problems with his internet. So oh, there you are.
Can you hear me?
Yeah. So did you hear the question, Dr. Era?
So I heard the second part of it. I was answering, then I realized that probably nobody can hear me. So regarding to contact tracing, we continue to have 100% response within complete response within 24 hours, exceeding.
I think Dr. Era's internet connection is breaking up again. I have him frozen now.
Would kindly repeat the first one. I would really appreciate it, or the first.
So sorry, Dr. Era. All I have is you frozen. I can't hear anything, and all I see is you a frozen image. We appear to be having some technical issues. Sure, absolutely. Dr. Era is going to sit behind me.
Appropriate physical distancing.
There we go.
Apologies to the group. Really, this rarely, however, it happened now. So the first part of the question, we continue to have 100% response, complete response to contact tracing in Grey Bruce within 24 hours, exceeding the provincial target of 90%. That's all we are required to do. However, we continue to have the track record. And I agree with the person who asked the question. The contact tracing in the province has been challenged in different health units, not ours. We have been proactive to up the capacity and recruit more contact tracer and move people within the organization to ensure there is sufficient capacity. If you would kindly repeat the first part of the question, I would really appreciate it.
Sorry, I unmute myself. Yeah, the first part of the question, as I recall, was I was talking about the 3 C's, and it seems like on school buses we have to forego the social distancing.
Stuart, could you start again? We have some technical difficulties here. Repeat your question from the beginning, please. Thank you.
Okay, I was getting a still image as well. Yeah, the social distancing, of course, is deemed impossible on school buses because of the crowding. So is the mixing of cohorts. As I've already expressed, there are dozens of cohorts mixed on my bus. The third C is not to be in confined spaces for any prolonged length of time. Today, you can drive with the windows open and the heaters off. Once winter hits, neither of those things will be possible either. Do you consider that to be safe conditions to continue transporting dozens of kids from dozens of cohorts on a school bus?
So you're describing a very realistic scenario. Kids from different cohorts are on the same bus for a period of time. And there is limited physical distancing between the students, I presume, not yourself. You have enough space behind you, correct?
Yeah, I mean, I suffer from cough D, so I'm
right. So your question
about my personal safety. I have responsibility for the safety of the students, and there is no space between them at all.
I just want to focus the answer to the safety of the students, so it's not a concern for physical distancing for yourself. That's true. However, there are all the measures in place in the school, in screening before people go to school and within school day, with hand washing. I can be, and physicians and nurses do it on daily basis, touch many patients on daily basis, as long as a person is mindful and the measures are in place, the transmission is quite low. So all these measures in the school would still transfer the benefit to this bus environment. Is it optimal to have cohorting on diluted or affected on school buses? It's not. Is it, does it mean that everybody on the bus is going to be a case tomorrow? No, absolutely not. And we have quite the evidence of it. And you look at countries like Denmark, Sweden, some other, Netherlands, they operated schools over the summer with 0 cases transmitted within a school. And they have similar protocols to the one we have. Again, it's not optimal. When you have open windows, there is lower risk. You close the windows, the risk increases. However, if there is no case on that bus because the screening took place and contact tracing took place in the community and in the school, that bus has many crowded kids together, but not transmission to everybody. And if there is one case, it would be the people around them. Nevertheless, we're going to not take risk and send these kids back to cohorts. So we might isolate more than just the people around them. And again, I echo your concerns. Like, this is why myself and my team actually are working around the hour to ensure these scenarios, if they happen, they're not going to be catastrophic.
Excuse me, but I understand that the protocols in the school help protect the bus riders, but the people around them that you're referring to, the people around any rider, is their family cohort, it's the people on that bus, it's the people in that classroom, and it's the people in the school they attend. So we're not only jeopardizing and risking the safety of the students on the bus, but in each of their cohorts as well. Is that not so?
You're using the word risking the safety. We're not risking the safety. We're doing everything to minimize the risk. You realize sitting on your couch in your home that there is still risk there. If we leave these kids in their homes, there is still risk. As a matter of fact, today I was talking to staff analyzing the risk for within our workplace, the health unit. The risk here is less than the risk in my own home. I have a daughter and a wife. Both of them have activities out there, whether going to group children or to grocery store. The risk here is less. The risk on the bus is higher. However, the period of time is not 8 hours. And we're taking calculated risk, accepting calculated risk to ensure the education and the well-being of students is in place. So the word we're risking the safety of kids is probably not representative of the whole process. And similarly, when we ensure these kids' risk has been minimized to the best of our ability, they can still go out and go back to their families, and that risk is not much different from their families or the kids going to any different setting outside.
Okay, I'll leave it there, Doctor. I understand that there's a higher level of risk accepted on buses than there would be in schools, but I guess there's nothing we can do about it. I don't have further questions.
Thank you, Stuart.
Thank you.
I'm going to ask a couple of questions that were emailed in. If a bus and a driver is quarantined, what communication takes place to whom, to what, and even is the company notified or only the driver?
So I will take Sarah at this question, and I will ask Sarah to complete it if my answer was not complete. We usually communicate with the case themselves over the high risk contact that will be asked to isolate or quarantine. In a setting of multiple individuals on a bus, we communicate with the school officials just because of the timeliness of it, and we receive the contact information of these individuals. Our contact tracers will call these families, these individuals or students, their parents, and ensure everybody's notified. Rarely ever we would go to asking people to call us. That will be a scenario that's not really related to schools, just because we have the list of people already, the master list of individuals involved. In certain community settings, we might advertise or send a media release saying, please call us if there is no complete list there. And I'll turn it to Sarah.
Yes, I agree that we would communicate directly with the case. We would not communicate with the bus company. We have all the names and contact information from the bus drivers. We got that at the beginning of the year, so we're aware on what routes and what buses drivers are responsible. So we would just be contacting the bus driver. It would be up to the bus driver to communicate with the company. If they're not able to do their route for the day, you don't have to disclose why you're not doing your route. Similar if you were a community case. So we ensure confidentiality. We're very careful to always ensure confidentiality for everybody involved in this situation.
Thank you, Sarah. I'll move on to a similar vein of a question. If a student or a driver is asked to quarantine, is there an opportunity for the driver or the student to get a COVID test and then return to work or school earlier with a negative test? And if not, why not?
So if somebody was exposed to a case and they're named as close contact, we will ask them to isolate for a period of time. And we don't test them immediately. We recommend testing after a period of time. That's the incubation period. Usually it takes the virus between 5 to 14 days to cause symptoms and be in the system obvious enough to be detected by test. So if we test too early, it's not going to be useful. When we test and it turns to be positive, that's a scenario to follow up. If it is negative, that individual needs to continue the isolation period because the incubation period might be longer than when we recommend testing. We usually recommend testing around day number 10. So by the time the test results come back, the 14 days is completed. And you can picture the scenario where somebody was tested on day 10 and they're negative. However, the virus or the symptoms started manifesting, or the virus started shedding on day 12 or 13. We have not done justice to that situation, and that's why they're totally different parameters.
Okay. Can we move on to, I got a question, or a couple of questions with regard to masks. What's the role, the responsibility of the driver to enforce the use of masks?
I don't believe the protocols would require enforcing. In a school setting, scientifically, the kids are encouraged, the students are encouraged to wear a mask. They're not mandated to wear a mask, and the reason behind it is the mask effectiveness is minimal comparing to the other measures. It's around 10% effectiveness. It's not much. On the societal level, it is useful. And if you implement it in a clinical setting, it's way more, just because people know how to use it and they're mindful of it. If you implement it in a public setting, it's around 10%. People tend to touch their face quite often, increase their risk of transmission. So the benefit and the benefit to them is countered by that movement. The collective or the sum of benefit would be to prevent transmission to other people, but around 10%. So this is in a public setting. If you go to kids and the younger they get, there is a less usefulness benefit of this intervention. And that's why mandating it really is not going to add much comparing to encouraging it. So that's the science behind it. The guidance from the ministries has been, to my delight, required over age 4 and encouraged under grade 4, and the word mandate was not there. If the bus driver want to help, it would be probably most beneficial if they encourage people. A verbal reminder. Enforcement might backfire and might not be beneficial to start with. I wonder if Sarah has more details to add there.
And perhaps we could pull on Gary if he's there as well, as far as the protocol. So my understanding of the protocol is that if you notice that students are not wearing masks on the bus, that you would speak to the school about it, and the school would in turn take that and talk to the parent of the child about it. I agree with Dr. Era that you would encourage the child, do some verbal reminders, some good role modeling, because you guys are all wearing masks is a good reminder to kids too. I'm wearing mine, where's yours? Come on, somebody doesn't belong here. You can make it a fun game, but it is the responsibility. You can chat with the school about it, and they can talk with the parent and the child about it. Do you have anything to say, Gary?
Hi everyone. My name is Gary O'Donnell. I'm director of the Bruce Grey Catholic District School Board. I just want to thank you for being here today and the work that you do to get our students to school and from school safely every day. You play an important role in our educational system. So thanks for all you're doing, and thank you for letting me be part of this. Yeah, I would, for our school board, I can speak for Bruce Grey Catholic. As always, if you're having issues with student behavior on a bus, you have your regular policies and protocols that you would follow, and I would confirm that you do that. In our board, students are and through the Ministry of Education, students are wearing masks from grades 4 through 12, and not so from grades JK to 3. So we're following the provincial mandate and working with Dr. R as well. So I think for the vast majority, most of our students are wearing their masks regularly. So we're encouraged by that. But if there's concerns, I would connect with the school principal as you would your regular protocol. So again, thanks for all you're doing. I'm happy to take more questions.
Thank you, Gary. I'm looking at some of the questions with regard to the length of time a child is riding on a bus, a higher risk of infection for the longer, or a higher risk for the longer that they're on the bus. Is there an industry standard for a time of contact and proximity that would increase the risk?
So that's a really good point. One of the factors we evaluate when we're evaluating risk is the length of time of contact. The longer it is, the higher risk there is. Usually under 15 minutes of within 1 meter, people talking to each other, that's considered close contact. And that will be high risk person. If one of the two is a case, the other person will be high risk. Having people in rows on a bus for an hour, obviously it's more than 15 minutes, but they're not all talking to each other face to face. Each person is talking to one person or two. So again, the scenario is if there's one case there, it's not like everybody on the bus has the same risk. It is the people around that kid. Nevertheless, we don't really take risk there. We try to be very conservative in our approach to evaluate the risk for everybody. And it's different for each scenario. You can appreciate if you're dealing with somebody who's 15 years old, you can ask them a question and you get a reliable answer, usually reliable, to see who they talk to. It's different from kids who are 7 years old and they might not remember or not realize or be mindful. Nevertheless, whenever there is a case, we do these assessments based on the situation at hand. The time frame is essential. There is no standard industry, usually the 15 minutes for individuals there. However, if there is a case on a bus, we're not going to really take risk to say kids who left the bus after 10 minutes are not included in the risk. We will evaluate everybody's risk as we go.
Thank you, Dr. Era. One question coming up on the chats is with respect to as the colder weather gets in, the shutting down of the buses and the ventilation issues. Is there anything further to with regard to closed buses in winter?
Definitely with any closed space, there is more risk of transmission. And we've seen this for the Black Lives Matters and the protests had happened outdoors. The risk of transmission was way lower than the risk of transmission indoors. With closed windows, definitely there is increased risk. Better ventilation might help. How much would it help? How much it would help? It's really not, similar to outdoors versus indoors. So there is an added benefit. However, I go back to all these measures in place in schools, not just on a bus. Hand washing is essential. I can sit in this office with many objects infected with COVID or covered with COVID viruses. As long as I wash my hands, the risk is really not there for me. Back to the question, I don't know, Sarah, if you have anything to add there related to ventilation and on buses.
I think just what you've said about the layers of protection. It's not just the ventilation, it's not just the masking, it's the layers of protection. The buses are cleaned regularly. The same cohort rides the same bus every day. They have the same driver. There's a number of layers of protection, so it's not just one thing that will be the magic bullet to prevent the infection. It's the combination of the layers of protection.
I'd like a little clarification on that point, because from my reading on the matter, it's been fairly extensive. The danger is aerosol in enclosed spaces. So we're not talking about the droplets, but we're talking about the fine spray. And that aerosol will spread very far, especially when there's a recirculating heater, which will break it down into finer particles, so it would spread throughout the entire space. Is that not correct?
The COVID transmission is still considered droplet. There are many research studies on COVID and other viruses. Anything could be aerosolized. Anything could be aerosolized as long as you put some pressure, air pressure on it. However, these scenarios that would produce aerosols really are limited to intubation, limited to dental procedures, some dental procedures, not all of them, when they have that pressured air to do their work. A ventilator on a bus, how much effect it's going to have to aerosolize. If somebody was coughing right into it and the vent is pushing it out, that there could be some scenario to do this. However, the evidence is overwhelming. It's not the driver of the outbreak. And if it is, wearing a mask would be useful in it. Again, limited utility. However, it really is not going to be a game changer that because we closed the windows and turned the vent on, and now it's all aerosolized and everybody in the bus is infected. It is not that scenario. So back to your question, is this not right? Well, it's right that there are aerosolized scenarios. However, it's not the main concern. It's still droplet. The size of the molecule for the virus is heavy enough. It's not measles that, you know, if you walk into a room and leave, it's infectious for 2 hours, regardless what you do. It is definitely not of that type.
Thank you, Stuart. One question that was written up here is how important is the cleaning on a bus if everything is close contact kind of stuff? How important is what the formite?
So the COVID-19 virus is not a hardy virus. It's easily destroyed by alcohol 16% or any type of soap or disinfectant. House bleach would destroy it within seconds. The virus itself survives on surfaces. The length of time is still, you know, it was around March, it was up to 2 to 3 days on metal and plastic surfaces, 24 hours on paper surfaces. Later evidence would show that the DNA could be, or the genetic material RNA of the virus could be detected, and that's where, if you test the surface, you will find it. However, it might not be infectious. Less than 24 hours is a practical term. Nevertheless, the science is still, you know, not 100% to say it cannot be found after 2 days or up to 3 days. So it's a possibility. When you look at reports of disease that happen through touching surfaces, there isn't reports of transmission through those. There is evidence that it can happen of touching surfaces, but not after 2 days, after 24 hours. It's not been reported after 24 hours, just to be more specific. There are reports of touching surfaces. Then you add another layer to it. What's driving the outbreak in the community or in the school or in the workplace? It is the interaction with other people who are sick. It's not touching surfaces. So there is evidence of touching surfaces in the first 24 hours, not past. That doesn't say that it cannot happen. It might, but all in all, touching surfaces is not the key variable that we need to be tackling at all times.
I'm going to add another part to that question that came up in the chat room. What about, which is obvious on every bus in winter, the condensation on the windows on the inside?
The condensation is vapor. That does not mean it's droplets, unless people are coughing on the window to make it to make that condensation. It's not different requirement to cleaning other than the regular cleaning. Cleaning the touch surfaces where people touch the handle, the bar, the condensation is not a concern in this case, unless again somebody coughed right on the window.
Yeah, that was just an add-on to your answer as it came up. And I have pretty well, between myself and what Stuart has added in his conversations, we've gone through most of the questions that we had been given. Is there anyone with any additional questions that want to come on? You can unmute yourself and bring yourself forward. Or again, you can use the chat function.
If I may, Drew, I touch base on asymptomatic transmission. So the screening takes care of people with symptoms, or most of them. Some people might not be aware of their symptoms. There's always the concern about asymptomatic, and there are around 30 to 40% of cases have no symptoms. The evidence was clear in May that they're not the driver of the outbreak, because people without symptoms shed virus, but for a short window of time, and their shedding is not as severe. So by the time they're identified, probably they already stopped shedding. And if they go through the screening process and not detected, there is still all the other measures in place, hand washing and disinfection and physical distancing. So again, they're not the driver of the outbreak.
Okay, we have Dan standing by here. Go ahead, Dan.
Yeah, hi. I would just like a little bit of clarification about the masks. I don't want to beat a dead horse. I was just wondering if I thought I heard that it was not, like in the doctor's talking there, I thought I heard that it was not mandatory for grades 4 to 12, or is that not true? I just want to know, because if someone comes to the bus in the morning and they don't have a mask on and they are grade 4 and up, do we let them on, or how do we proceed again? Just to be clear, that's all. Thank you.
Thank you.
I think that's a question for the board people. So maybe Gary or Lori, do you want to take that on?
Sorry, Sarah, if I may, just before we turn to the school officials. In science, it is encouraged to everybody. In the recommendation from the province, all the documents I've seen would say it's encouraged for younger kids under grade 3 and under. Grade 4 and up is required. However, required as rigor is different from mandated. Required, but again, the application of it, I would leave the question for the school officials. They are the people who can answer that question and its application.
Hi, good afternoon, everyone. I'm Lori Wilder, Director of Education for Blue Water District School Board, and thank you so much for joining this call today, and for Dr. Era taking the questions, and for Drew moderating and Sarah supporting. It's great to have us all here in this forum to be able to ask questions. So we here in Blue Water, and in Bruce Grey, and I know that Gary may want to speak as well, we follow the operation guidance that's been provided by the ministry, and that does mandate masking for students in grade 4 to 12. So we do adhere to that here in Blue Water. The only exceptions would be if there are medical exceptions that a child may have. So we do honor those as well. But there is a requirement that students grade 4 up to 12 do wear masks. So Gary, I don't know if you had anything to add to that.
Yep. No, thanks, Lori. Yep, we're governed under the same guidance document. So as I mentioned earlier, 4 to 12, our students are wearing masks, and at JK to 3, we're encouraging students to wear masks. Some are, some aren't, as we go through our system. If you encounter a student who is in 4 to 12 and they're not wearing masks, again, as we had talked about earlier, and you're concerned about it, you've heard Dr. Ara, his advice from a medical perspective. Always, you know, I would defer to the principal, and we can communicate with our principals through our memos to reinforce wearing masks on the bus. So we'll get that messaging out. We message usually on Friday, so we'll message that back out on Fridays. Thank you.
Could I ask a question about masks?
Go ahead, Jackie.
Just to elaborate a little bit, I know in some districts that masks are mandated for all bus riders, JK through to grade 12. And also in some regions, load counts are restricted to 46 to 48, which means only 2 to a seat rather than up to 72 for the Blue Water Board. Why would some areas reduce the loads and increase the mask wearing policy and the Blue Water Board not? Is it based on what's happening in Grey Bruce as far as our numbers and things are concerned?
So I'll be more than happy to take a stab at it, although it's directed to the school officials. Through your permission and approval, I can take a stab of this. Any measures and the level of restriction is directly related to the epidemiology in the area, and we do stand at a relatively positive position comparing to the rest of the province. For example, the 2 meters distance, it is recommendation in North America from World Health Organization. It is 1 meter, and there's no magic about the number 2. It's just the further you get, the less risk there is. But 1 meter recommendation for the whole world, just because they tend to have more space we tend to have more space to what we do here. And it's directly related, as I mentioned, to the local situation. So if there is a number of kids on a school bus, 2 to a seat would be optimal. 1 to a seat is perfect. Is very desired. But again, there is enough resources, limited resources, to be able to provide the services. So if it end up with 2 people on a seat or 3 periodically for a certain age or a certain group, again, it's quite acceptable risk. And I'll just turn it to Gary and Lori if you wish.
Mm-hmm. I was just going to add just to the comment there is that we are in a transportation consortium. So it's not Blue Water making a different decision than Bruce Grey Catholic, because we are all in a consortium together. So the decisions that are being made around that are both boards directed by the Transportation Consortium. And Dr. Era, exactly what you said, for us, our trustees did not make a decision to mask students in JK up to grade 3. They didn't feel that it was necessary. And we are following the ministry guidelines in terms of masking for students.
Yeah, no, I don't have anything else to add. Thanks, Lori.
Okay, once again, I would ask if there's anyone with any additional questions. Entertain them through the chat room, or even just make yourself available, unmute yourself and come forward. Is that Sherry? Go ahead, Sherry. I see Sherry, but I don't hear her. Are you wanting to ask a question, Sherry? No. Maybe
This is Dennis. I've got a question with the chemical that we're using in the Blue Water Board. Is it acceptable to wash down the seats and backs of the seats to take this residue that's left over from spraying off of the seats? Or can it be left on? And what kind of damage, or is there any kind of contamination to the body of people touching that chemical?
Thanks for the question. I'll respond, and maybe Steve Lustig can jump in as well. Any chemicals that we have, that we use in our board, are all, we have WMIS standards, which are security or safety standards. So we must follow the safety standards. We would not be using any product that would be harmful to a person in any way at all. And we do follow the safety data sheets that come with those standards. I'm not specific in terms of the dwell time that you were talking about, and I'm not sure, Steve, if you can address that specifically, but I can reassure you this will not harm people in any way.
Yeah, Lori, let me jump in. This is Steve Lustig with the consortium. The consortium started back in July working with the bus operators on what product we wanted to use for disinfection. And with any product, as Dr. Ara alluded to earlier, there's many out there that can work against COVID. And when we got down to trying to pick one specific product, the application process of that product didn't necessarily meet the abilities of every operator. So we have operators that have buses that all yard at the yard. We have other operators who have most of their buses yarded at a driver's home. And so we had to take all of those considerations into play. And at the end of the discussion, the consortium left it with the operator to choose the product that best fit their specific circumstances, as long as it met 2 criteria. And one of those was that it had a DIN number. The other was that it was on the Health Canada list of products that had evidence against COVID. So that's how we came to choosing the products. So again, it wasn't a board or consortium decision, it was actually an operator decision as to what product best met their circumstances.
Thank you, Steve. I'm seeing perhaps a question from Ted Wright. No, go ahead, Ted. No?
No, I don't have a question.
Okay, okay, I'll mute you again.
I have a question.
Go ahead, Jackie.
And actually this is probably for Mr. Lustig, will the consortium stand behind the recommendation that the seat directly behind the driver should remain empty rather than occupied if the count dictates that you need to use that seat? Can we and will the consortium support keeping that seat empty?
Yeah, Jackie, if I may, certainly we do. So that was one of the measures that we had proposed for operators, and we're entirely behind it. We did do a ridership count back in September. Counts we got back wouldn't indicate that we needed to fill that seat behind the driver on any of the routes. If we're finding otherwise, certainly through your operator, let us know, and we will look at opportunities to move kids off of that vehicle.
Thank you.
Thank you, Jackie. Thank you, Steve. Stuart, are you wanting another question?
Yeah, Jackie reminded me of this, and it's for the consortium, actually. So very early in the year, I was requesting to post the protocols around COVID-19 on my bus. And my understanding is that the consortium won't allow that. I'd like to know why the consortium won't allow that. And I would like the consortium to change their mind on that.
Yeah, Stuart, I don't know that the consortium categorically said we couldn't post information on the bus. Certainly buses have to stand by a D250 standard. We already have a number of different communications posted in a vehicle. Certainly we need to keep track of and be mindful of over information, if you will, and the impact it has if we include a bus with communication. But if there's suggestions or recommendations on signage that you might like to have in a bus, we could look at that. As I say, I don't think we've categorically said we can't post information in the vehicles.
Okay, I appreciate it if you'd follow up on that. I've asked on 2 specific occasions to be allowed to do that, and I was not.
Stuart, if I may ask, who is it you work for?
I work for First Student out of Kincardine.
Out of Kincardine. So I'll follow up with Matt then. Thank you.
Do that, please.
Okay. Again, I don't see anything else coming in. We're gone the hour. Perhaps maybe appropriate to maybe hear from Gary and Lori, and then we'll let Dr. Era wrap it up.
Drew, there's just a question there from Sherry. She wasn't able to ask it, so she typed it in.
Oh, okay.
And we're recommending that she talk with her employer about this. We don't have a say in the bonuses that are awarded to drivers.
If I could jump in then, I would just like to thank everybody for their participation today. It's great that we've had an opportunity to get together, and Public Health has been a wonderful partner for both of our boards and the consortium. So thanks for your time today, and thanks for responding. Dr. Era is always willing and able to respond to questions, which has been so helpful for all of us. I do feel that you know, there's been a lot of learning for all of us the past few months, and we've all done a great job. And as drivers, you are frontline for us, and we greatly appreciate what you do for us and for the students and families of Grey and Bruce County. So thank you very much, and drivers, and to the companies that provide the service for us. We are totally indebted to you and very much appreciate your support. So thanks very much.
Good, and thanks, Drew, for the opportunity to give closing remarks. I too want to thank you for the work that you do. One of the kind of jobs as director, your hours are a little different. And there's many days I'm driving in and I'm behind a school bus. And I'm always struck by the awesome responsibility, because families give us everything they have when they place their child on the school bus. And to see a mom at the bottom of the laneway, and she's got a baby in hand and she's getting her child on the school bus. It's an awesome responsibility. On behalf of our families, I thank you for the work that you do. And then at the end of the day, to be driving again and to see a mom at the bottom of the laneway, or even a brother or sister, and their eyes lighting up as a little one comes off the bus, it's really rewarding. So please know the work that you do is an integral part of the education that we provide for our students and for our families. So as Laurie had mentioned, thank you for all that you do. It's important work, and it's even compounded with COVID-19. And again, it's a challenge for all of us, and you're making it work through challenging situations. And again, we appreciate, on behalf of the Board of Trustees as well, just a big thank you for all that you do. Thanks, Drew. Thanks, Dr. Ara and Sarah.
Thank you very much, Gary, and thank you, Laurie. I'll turn it over to Dr. Ara for any closing thoughts you may have.
Thank you all for attendance and for your concern and for your work. I echo Gary and Laurie in what they said, and they said it best. I can just describe the last part that Gary said, that compounded by COVID-19. What you're dealing with, the responsibility you have, and the risk that you are willing to accept for our children, for our community, to proceed with the education they need. That risk and that responsibility is unique. Nobody before you for the past 100 years, and at that time probably there wasn't the school system bus that we have right now. So you're the first. Nobody before you has to deal with this, and we're all in this together. I know it sounds like a cliche because we repeat it every day. We're all in this together, but it is truly a cliche that's manifesting itself every day in a different meaning. That nobody accepted the responsibility that you have accepted in the history of humanity. This is not an easy task, and for that I really thank you that you're taking care of our children and our community. Thank you.
I'll slide in now. Thank you, Dr. Ara. Thank you, everyone, for joining us on this Zoom event, and let me offer my apologies for the technical issues, but we rode with it and got it figured out and went to something else instead. Adaptable. As I stated at the outset, this has been recorded and will be posted on our YouTube channel. Any additional or unanswered questions can be forwarded to our Contact Us page on our website, or to our 1-800 number, 1-800-265-3459. I should never go off the top of my head. 1-800-263-3456, extension 3000. And again, our website is Contact Us at is our page, and you can go to Public Health at publichealthgraybruce.on.ca. The health unit, both boards and the province, again, have extensive resources available on their websites, and I encourage you to use those as resources as well. And again, thank you very much for joining us.